Well, Boyd, first, I want to thank you for joining us out here in this gorgeous Park City. I'm a little jealous that this is where you get to live
This
all
is
the
our
time.
normal.
It's just stunningly beautiful here. So thanks for making the trip. I'm excited to talk about payer-provider collaboration with you. I know that is a topic that you're very passionate about and you're actively working on a number of fronts. So maybe you can kind of just kick off with what led you to kind of be a part of this coalition and why are you excited about the opportunities for payers and providers to collaborate more?
Yeah, it is a passion of mine, and it's been a journey. I started at KLAS. As you know, KLAS, we measure vendor performance in healthcare. We try to give transparency to health plans and providers as they make critical and expensive decisions. And as I started at KLAS years ago, I was overseeing our revenue cycle research. Mm-hmm. And as I worked with CFOs, VPs of rev cycle, and others, and sought for feedback on the reports we were doing, the feedback I got was, keep measuring my clearinghouse vendors, keep measuring our patient accounting vendors. But if you really want to help us, our health plans are actually affecting our bottom line or our business way more than our vendor partners are. Mm-hmm. And I felt drawn to that, but also know that KLAS helps health plans with their business and their decisions. And so as I sought to seek out their input, it was amazing how they had some of the similar challenges. As they say, KLAS, keep measuring our claims health vendors and keep measuring our payment integrity vendors. But if you really want to help us, you'll help us with these health systems that we cannot get straight answers and common data insights from. Mm-hmm. And so that was really the catalyst for us to really start finding ways to kind of meet health plans and providers in this intersection that's filled with inefficiency.
Yeah, and I also, as you know, Trend is on a very similar journey. And it seems like, from our point of view, that a lot of it breaks down in just, we don't seem to know how to talk to each other. There's just kind of a misunderstanding or a different sense of language and glossary of terms and things of that nature. So can you maybe share, how did you go about starting some of these conversations in the very beginning?
That's a really good question. It's interesting you say that, because even when we talk about denial rate,
yeah,
we can't get health systems to agree on how that's calculated and what that is, much less the health plans agreeing with health systems. And so a lot of it just came to incentives, meeting people where they're at and finding the common points of language. And really it's with the patient members. Both health plans and providers are extremely passionate about providing great care at a great cost,
right,
to the patient members, to us, to our communities, to our families. And so really starting there and then expanding. Because really, at the end of the day, we do have misaligned incentives. And even without that changing, we can align on so many things that will move us forward.
And how would someone, so we like to say, do what you can in your 20 square feet. You've heard me say that. So if there's someone watching, whether they're on the payer or the provider side, do you have any guidance on how to start just changing the way that you interact with one side or the other in their 20 square feet?
I'd say two things. Number one is it always starts with individuals. It starts with passionate folks. So talk to someone who will talk to you, for number one. But number two is seek for understanding, both on what you do, make sure they understand the whys and the hows of what you do, but then also listen and try to understand the hows and whys of what they do. A lot of times we have this preconceived notion that the health plans are all evil and they're just conniving behind closed doors on how to keep all the money. And there's some truth to that. Not the evil part, but just there's incentives that have them really kind of serving the employers, serving the government and the patient members into making sure that the care they get is affordable. But then the providers aren't as inept or upcoding as the health plans would kind of believe as well. And what we found is people really do build those bridges of understanding. They start to see, I understand why you're doing this, and solutions are easier found when you understand the whys of the other side.
Well, I know you kind of have KLAS has a whole conference on this topic specifically, right? The K2 conference. So, and I heard so many great points of light, studies, and all those kinds of things. But what is kind of your favorite story, if you can share, of a good case study or an example of payer-provider collaboration that really generated better outcomes?
Yeah, there's many of them. There's a lot of them around prior auth. There's a lot of them around transition to value-based care. There's a lot of ones, and I had one that I really liked. It was one we did a couple years ago, and I really liked it because of all the different stakeholders involved. And yet it was really small. It was pretty simple, and basically it was a school district having challenges predicting costs around their care. And so they partnered with the health system. They partnered with their health plan to say, okay, can you give us just a little bit of predictability here? And they started small. They just said, okay, we're just going to start with our maternity costs and care. And so I don't know how many, I can't remember the number of pregnant women in that school district, but it wasn't a ton.
Right.
But they got to a place and physicians were involved, the health plan was involved, obviously the provider was involved on the care level and the operations level as well. But just kind of open communication and having this clinician come and talk about the ins and outs of rev cycle and the ins and outs of payment and the ins and outs as a clinician, it was amazing. And just the lift that he had to do internally, kind of personally for that. And yet at the same time, they got to a place where they understood all sides. They were able to streamline and deliver to the school district what they needed to, and that was predictability. And then also they created an understanding with each other. So they said, okay, what do we tackle next? And that kind of scale and expand is really what we've seen. All of these points of light start with a measure of risk and just trust that the other side's going to do what they say, and some sharing of information.
Yeah.
They all start with sharing.
It's so interesting because as I've encountered a lot of people and engaged a lot of folks in these kinds of conversations, the word that always comes up, always, without fail, 100% of the time, is trust. And it seems as though there is a lot of, I guess, policy and procedure designed around really a lack of trust. So from your point of view, how do we start to change that continuum and build trust back so that we can maybe start to take out some of the policy and procedure that gets us all twisted up like pretzels?
Yeah, and I would never say someone should just jump in and just blindly trust all the other parties.
Right.
There's a reason. I haven't talked to a provider yet that says, let's get rid of the checks and balances.
Right.
I think all the health plans the providers feel that. It's just not true. They understand a lot of that and the safety that's there. What they're seeking out is predictability. And so what we've seen where it works really, really well is to start really, really small. Think small and then just go a couple degrees smaller. The challenges that we have both with health plans and providers is to make a single decision. Often there's several stakeholders, there's committees, there's a lot of things. The governance structure that we have on both sides is siloed and really hard often. And so anywhere you can get to where it's a departmental decision or a smaller kind of decision where you can go out and test things with very little risk and high upside, we've seen a lot of those succeed and scale.
Yeah.
And both parties have to win. We can't just think of ourselves. And so when we have a health plan saying, okay, but how is this going to be sustained for you as well as us? Those are the right questions to ask, because if there's only one winner here, it won't be sustained.
Yeah. It's interesting. I did another interview, a Healthcare Harmony interview just a few days ago, and one of the topics that came up was what are the personalities or the skills, interpersonal skills, that should be in the room when you're starting to have these conversations. That was kind of the guidance that person gave. And I'm curious, from your point of view, what is the relationship between success and like leadership skills and behavioral skills and just interpersonal communication? Like, do you have an ideal persona that leads these kinds of conversations?
I think there's a passion, right? You see so many things. If we're looking beyond this, we look at things like social determinants of health, precision medicine, where we don't know how those things are going to get funded, but we certainly have passionate people around it. I think the same things around this is the people that just, number one, they will not accept the status quo. They'll say the status quo is not working. We need a shift. But then also kind of an eye open to being wrong.
Yeah.
And pivoting and kind of meeting people where they're at, and a willingness. A lot of times our most passionate leaders don't want to take small wins, but it's a willingness to kind of take the little wins
Yeah.
as you can get them. And a lot of that's just a conversation. I remember I recently was at a lunch with one of my healthcare provider friends. We were at a conference and we were sitting eating lunch, and a health plan that they work with happened to sit down at the table. And it was interesting because she wasn't prepared for that person to sit down, but she knew who he was, and said, you know what, I have some data to share with you. And she just shared that there was 5 different prior auths that their health system has had, and over the last 2 years, that health plan had paid for 100% of them in those 2 years. And yet there was a lot of back and forth, there was a lot of denials and waits, and you know what I mean, just a lot of friction and waste in getting those 5 prior auths paid overall. And the health plan, almost on cue, opened his laptop, and it took a little searching, but he said, well, let me just share you this. Because her intent was, let's just cancel them. Why do we have them if you pay them 100% of the time? Let's get rid of the waste. You save resources, we save resources, we all win. And so he flipped the script and just kind of showed a chart on his laptop that said, when we remove prior auths, utilization goes 2.5x.
Wow.
And that was learning for her. And so she kind of took that in, and she didn't double down. She goes, okay, well, maybe we don't get rid of them, but how do we get rid of the friction? Like, let's talk about the waste and the friction in this back and forth. And it created an amazing conversation that I think is still ongoing.
Wow.
With those 2 organizations on ways to how do we smooth this out and automate a lot of these things and really flip the script on this friction.
So that's great guidance. So I heard you say, you know, people that are open-minded, people that are passionate, people that are willing to take kind of small wins and find the win-win. Any other guidance that you would give to someone that's listening to us today on how to collaborate better with the other side?
You know, I talked to a friend recently, and she's passionate about this, and she's on the payer side. And I really have thought a lot about what she shared, and I've pushed this on others. So I'd love your thoughts here too. I'll just kind of present it to you. And she says, you know, it's a lot of people could say, and they might be right, you know, with misaligned incentives, we will never get out of a place. You know, we've built the friction into this system. And she's challenged that. She says, what we need is probably 250, 300 passionate, empowered folks in healthcare that are challenging the status quo. And almost like drips in a bucket, all of a sudden will soon be just kind of flowing. And it's not that we're going to change the incentives. The incentives are there actually to help our patient members have cost affordable, great care. And we want to keep that, but create an environment where there's enough of us here together challenging the status quo and showing wins. You know, as soon as we win in working together, we're a copycat industry, and it's just gonna come tumbling.
Yeah, I actually I agree with your friend. I think that because I've had this conversation with many people, and the fallback position is it will never work because we have misaligned incentives. And my point of view is, well, there's a lot of places in life where you have misaligned incentives, but people have to figure out how to cooperate. And I don't think that this is an exception to that. And I think it may be harder, or it may take more creativity, more patience, whatever those things are. But I think that there are definitely win-wins, and we have to be willing to find them. That's just my 2 cents. I think it's a little bit of a cop-out, right? To just be like, oh, that's too hard, or it's too complex, or I'm too impatient, or whatever. But I definitely think that there's a win that can be found if you're willing to look for it.
Yeah, and if we can do this collaboratively, I'm speaking health plans, providers, even patients getting involved, employers, and there's so many stakeholders here, which makes it complex, but it also makes it doable.
Yeah.
And we've seen so many things, even just looking at the connection platforms, just easing the burden of getting the data to flow back and forth. And now we're just at a place, the technology's all there. So we're at a place where just people need to be willing to turn the dials and pull the levers.
Is there a particular area of technology that you feel like is going to help this movement?
Is it a cop-out to say AI? Just kind of, all I'll say this is it's not our gap right now. I think we have so much technology and automation. I look at what Trend is providing right now and the things and the services that you guys do and engage with. Our biggest gap is still just the parties being willing to turn the levers and pull the dials. It's all people right now.
Yeah.
Now, can we improve the technologies? Can we do a lot of things? Absolutely. But we can have the best communication platform in the world. And both parties aren't willing to play, it's not going to do what it needs to do.
But you know what, to me, that's good news, because that means that all of us, if we were to decide, you know, as an industry, if each individual or 200 or 300 individuals decided, I am going to do the thing that I can control, which is my behavior, which is how I talk to people, which is how I, you know, show up for meetings and all those kinds of things, that means that there's hope on the other side. It doesn't take billions of dollars. It doesn't take massive investments. It really is just a change of heart, which, I mean, maybe the hardest for some, but maybe to others, it's just flip the switch, right?
Yeah.
Awesome.
Yeah, and so one of the things I'm working on right now at KLAS is we're working on a measurement where we're actually trying to provide some, I wouldn't even say safety, but just some visibility to providers. Because I'll be candid, there may be some plans there where it's not safe.
Absolutely.
We can go and report back. But what we want to do is measure and say, okay, providers, for those health plans that you have engaged with, where you're exchanging data, where you're going this, what have been the positive consequences, what have been the negative consequences, and what are the positive and negative outcomes that you did not anticipate? Because that's the questions they're asking. They're like, okay, what am I not seeing?
Right.
You know, I can see what they're agreeing to, and there's agreements in the contract things, but what am I not seeing? You know, what are the risks I'm taking? We just want to have predictability. We want to have some consistency. And at the end of the day, I mean, we're talking about the outliers.
Right.
We're talking about the claims and the denials and the overpayments and the underpayments that affect, you know, less than 5% of the.
And to some
the
degree,
transactions.
and to some degree, a lot of where we are today is the result of bad actors on both sides, right?
Yeah.
And we're always going to have bad actors, but I think we have to rise above that and realize that that's not necessarily the case. I was at an event last week, and as you know, most of my career is on the provider side, and so I came to this position with a set of beliefs and understandings of the payer side, and what we hear a lot from providers is we don't understand. You talked about predictability, right? Like we don't understand what payers are looking for. The goalposts always move. There's ambiguity in the rules. You know, it's kind of like a black box. That's what we hear from providers. And then what we hear from payers is, well, we disagree with that because we feel like we're giving them all the information and they don't do anything with it. They refuse to change, that, whatever that is. So there is just such a fundamental breakdown in communication between the two entities. So I'm curious, from the people that participate in the K2 Summit and the Points of Light, even though they may not have a Points of Light study on a particular topic, do you feel like in aggregate they are getting better understanding about things broader than just whatever that case study is?
I think I don't know if this is answering your question. So let me just kind of just address it this way. It's interesting. When we first started doing these Points of Light back just right after COVID, and I remember one of the first ones we did, it was actually, there wasn't a vendor involved. It was presenting to us by a provider that basically said, we're sending higher up associates, we're sending senior leaders to our joint commission meetings with the health plan. And in return, they started sending so we're sending people that are more empowered to pull levers and turn dials to our meetings, and we've had better effects from our meetings. That was the point of Light. That was the point of Light, is we're communicating better and we're having better, more structured meetings.
Yeah.
But at the same time, it created trust, it created more movement. But I think at the end of the day, one of the challenges that still needs to be solved, and it's almost like when we talk about autonomous coding. We can talk about automating so many things and the power of AI and automation, and there's several vendors there doing some amazing work. At the end of the day, you got to go further upstream and standardize documentation.
Yeah.
Which I think we're working on. I think ambient speech. Again, I'm kind of going off on a tangent here, but my point is, I think until we kind of get to what we started this conversation with, is we're speaking different languages, we're on different pages, and we need to get to a place where a provider works with a health plan, and they don't have that health plan's portal, and then they go to the other health plan and they have their portal and their process of working with them. We need some way that we can have some standards here, and by the way we communicate, the way we work with each other, the way a prior auth for a hip replacement looks. Yeah. Because right now it could vary so much health plan to health plan. But when we see these points of light happening, to answer your question, we see them getting to a better place of communication and just the way they talk to each other, the way they meet with each other, and just opening doors that previously hadn't been opened as they solve a problem.
Yeah.
So it's not just about the maternity
Yeah.
patients at that
Right.
school district. It's about all of a sudden, we have a way, I have a person over at the health plan now that I can turn to, that maybe they're not helping me solve this specific thing, but they're opening doors behind the scenes for me there.
Yeah. Well, it gives me hope.
Oh, I have so much hope. There was a while I talked about how, I kind of joke, and I still do, that I'm Sisyphus trying to push this stone up the rock, forever. But what's amazed me is that there's people at every organization I talk to. Organizations move slow, people move fast.
Mm-hmm.
And as we get more and more people moving fast, it's going to be 2 steps forward, a step and 3/4 back.
That's right.
And that's okay.
Mm-hmm.
That's okay. Let's celebrate that quarter step forward,
Mm-hmm.
net,
Mm-hmm.
because at the end of the day, what are we doing this for?
Yeah.
I think I shared with you, I had a son in the emergency room yesterday.
Yeah, right.
And my wife, I work at KLAS, and so I want to ask about the EMR system they're using. I want to ask about the smart pump. And my wife always reminds me, you're here about your son. But it was amazing the common ground we're able to find as we're working with the insurance company on the phone and the health system. And we're siloed, and it's separate, and it's difficult right now. But it's not like it was 5 years ago.
Right.
I think in many ways we can look and say, we're not where we want to be, but in many ways we're getting there.
Wow. Well, that feels like the right spot to end this discussion. That was so wonderful. Any last thoughts you'd like to share before we wrap up? I
would just say a call to action.
Yeah.
We appreciate Trend's partnership in both K2 as well as the other things we do in kind of waving this flag of saying, hey, there's a better way that we can collaborate together, and we all both can win.
Yes.
And we would both win, and patients win, healthcare wins, U.S. healthcare wins.
That's right.
And so my call to action is look for ways in your organization. Look, like to your point, my 20 feet.
Yep.
Think for things that you can do in your role to do this. We had a point of light where, a lot of times these point of lights, you get a little bit of view behind the curtain. And there was a health plan that was a little bit vulnerable and shared, I think, a little bit too much if I was their health plan leader. But basically said, our first response was, where's the money here?
Yeah.
And they said, no, this isn't about the money. This is about the patient. This is about providing care in the home. This is all these things, and how this individual had to fight through their own organization to get the right thing done.
Wow.
But they
did
it. They did.
Yeah.
And by the way, they showed improvements for their health plan.
Right.
And then the provider showed improvements for their health system. And they were able to show patients getting healthier. And those things spread.
Yeah. And so when you think about what can someone do, the call to action, what can you do in your 20 square feet, it may not be a complicated process. It may just be how you show up for that next meeting, how you engage, the other party in that next conversation.
Seek to understand.
Yeah.
Seek to understand, because at the end of the day, I've seen so many people move roles, and they say, I'm at a health system right now, like you, right?
Yeah.
You're on the provider side,
Yeah.
and you're in a place now where you're working with a lot of health plans and really understanding and listening.
Oh, it's been so enlightening.
And what I see is I'd be doing the same thing if I was in that role.
Yeah, so enlightening.
But I think there's ways we can do it.
Yeah.
I think there's ways that we can reach and build bridges and not walls.
Well, Boyd, thank you so much for joining us today and spreading the message of hope and collaboration across healthcare. You know how much we appreciate the partnership that we have with KLAS, all the work that you're doing, and in this beautiful city. If you haven't been to Park City, I highly recommend everyone coming to view. And it's fall here, and it's just beautiful.
And you picked the day.
Yeah,
it
it's
is
stunning.
Like the day when the leaves are changing.
Yeah, it's wonderful. Thank you so much, Boyd, and we'll talk soon.
Thanks, Sarah.
All right, thanks.